If you think you already know most of the things you need to know about the dreaded coronavirus, talking about its characteristics and how to keep it at bay, you will realize that there is a lot much more you don't know yet, but will get to know after watching this episode of Health Options, the program that enables you make informed choices about your health. There is no known definite treatment for coronavirus at the moment. The search for a cure for COVID-19 is one that has kept scientists and researchers across the globe on their feet as the pandemic rages on with the attendant devastating effects and challenges. Nigeria, as you know, is one country that is richly blessed with different species of medicinal plants, and the call out there is for those with the scientific knowledge to get to work by exploring the benefits of medicinal plants as immune boosters, get their findings validated with a view to mitigate the spread of COVID-19. It is against this background that we shall take a look at how the country can harness its numerous immune-boosting medicinal plants with a view to mitigating the spread of COVID-19. Thanks for joining us on the program. I am Rabi Abdullah. Watching Health Options, and our discussion segment is on harnessing Nigeria's immune-boosting medicinal plants in the face of COVID-19. And joining me now in the studio to take us through the discussion is the Director, Traditional, Complementary and Alternative Medicine Department, Federal Ministry of Health, Pharmacist Zainab Ujtud Sharif. Thanks for joining us on Health Options, Hajia.
It's always good to be here and glad.
Okay. You will agree with me that this is a period that everybody is on the edge, and of course scientists are not sleeping. You are an authority when it comes to, medicinal plants in this country, and it's on that note, without wasting much of our time, that I would like you to tell us where that stands, or where that should stand at this critical period.
The whole globally we are all facing this pandemic, and from scientific evidences we know that there is no known cure yet. Like you said, this is a wake-up call for scientists, and scientists out there are trying to look at the possibility of getting a vaccine for the cure. But meanwhile, for us to get a good vaccine, it may take up to 12 to 16 months. So what happens to the people? Do they all die while waiting for vaccine? That is what nature doesn't like. There is always something that can fill in the gap.
There shouldn't be a vacuum.
Yes, there shouldn't be a vacuum. Okay. And that brings me to believing in spirituality and believing in God. Because God has provided something for us. But it's left for us to search and know, like you said, and validate. Why am I saying that? Specifically, Nigeria is one of those countries that is blessed with fauna and flora. We have over 8,000 species of medicinal plants. We have not tapped even up to 10%. And a lot of scientific work has been done. A lot of universities have churned out researches. But the sad thing is that they are all lying there in the shelves, dusting away. But what is important is that it is time now. Every country is looking inwards. Inwards in the sense that what do you have and what can you do to manage? Despite there are protocols already established, which is very important. The protocol of immediately understanding the signs and symptoms of COVID-19, which we all must re-emphasize for the purpose of our viewers understanding and practicing. The need to always make sure that after all, we wash our hands and ensuring that the tap flows. That is very, very important. And also the need where necessary, the use of hand sanitizers. And of course, practically social distance is very, very important. However, with that, what else can we do? We should focus on the aspect of nutrition and immune boosting. What do I mean by nutrition? No matter how we do, whether you are sick or you are not sick, you still need to eat food. And we know that food is the first medicine, because food provides growth, food provides the nutrients that will enable you to grow, to be healthy, and stay physically fit. That means food is qualified to be called a medicine. In this case, at this period, we want to advise our viewers that you pay more attention to simple nutritional foods. And these foods, are they affordable? Are they available? And are they qualitative? Yes, God has blessed us with some of these foods that we can use. Yes, some of the foods we look at that have high nutrition value, depending on how we make it. Let's look at the vegetables. Nigeria is blessed with so many vegetables. I would want to go for vegetables that have the immune boosting capacity. What are the kind of these vegetables? We have the local Telferia occidentalis, which is ugu. Ugu is very common. It has high amount of nutrients. A lot of work has been done and is shown to have immune boosting activities and some antimicrobial properties. Okay. And what do we look at? The Moringa oleifera. We know the nutritive value of Moringa with the rich nutrients, and it is able to support the immune system. So our people can do a lot of clean, either taking the juice with carrot. Carrot is well known and established, rich in nutrients with immune boosting. We have these things, and we can take them in juice form or in a food form that is not overcooked. It is very important in the aspect of food. Soya beans is available. We can make a lot of tofu. We can have, what I mean by tofu, the curdle. The ones we make, we call them at times, you tell to call them wara locally, and I'm sure cheese, other, yes, cheese-like, cheese made out of soya beans. All these will provide us with nutrients, and they are readily affordable. We have millet. All these are common foods that we know they have nutritive value. Then, like I said, the vegetables, we have the cruciferous vegetables. What do I mean by the cruciferous vegetables? The cucumber, the cauliflower, okay, the carrots, the broccoli, all these are called cruciferous vegetables. They have the ability to provide phytonutrients, and these phytonutrients, antioxidants, which are able to boost the immune system. Okay,
let me take you back to the issue of harnessing our medicinal plants.
Yes.
Now. I don't know, I heard from the grapevine, even though it was discouraged from listening to rumors.
Yes.
I heard from the grapevine that even the U.S. is exploring how to get neem, the neem plant from Nigeria, in the face of COVID-19. And we have a lot of neem trees, especially in the northern part of the country.
You know, people don't always value what they have. And I don't know, especially in Africa, you find that what we have in front of us, we don't appreciate it. You remember the story of bitter leaf? We all know bitter leaf is very common, until there was a kind of submission from the US where a lot of research was done on bitter leaf as the magic plant. Then now you see everybody saying, so is it bitter leaf? The same applies to us with all other plants that we have. There is this submission from US trying to find out the neem tree. What is the purpose of the neem tree? But from research findings, scientists have done a lot of work. Even NIPRID is supposed to be working on neem tree. And we know that the neem tree has antimicrobial and antiviral properties. Okay. This is well scientifically documented. Okay. So possibly, let's see the further research that needs to be done.
So that's why our scientists and researchers back home should really
look
get
at
to
the
work.
Possibility of that.
Okay.
And then there are also, you see, I tend to give a historical perspective. In the 1918, the Spanish flu. During the Spanish flu, there was this submission that the grandmothers were at work. What were they doing, the grandmothers, with their knowledge of what we call the home remedies? Okay. They were using a lot of garlic. They said garlic became very expensive, like gold, because there was this submission that homes should eat more of garlic, should take garlic capsules, should take garlic oil, should take garlic powder, as far as going to put garlic cloves in the socks of the children, babies. You begin to wonder why. And then at the end of that pandemic, homes and houses that utilize a lot of garlic had less fatality than those that did not.
Are you invariably asking homes to
That means we have garlic. Okay. And garlic is a medicinal plant with a lot of value.
How should it be used at this point?
I have told you garlic, we can use it more to cook, but don't overcook it. Maybe when you are about to put the food down, you can chop and put the cloves. Or simple, you can blend garlic, lemon, and extract the juice and mix it with honey, especially for kids. You can take a teaspoonful 4 to 5 times daily. I am giving the dosage because these are holistic foods. And when we call holistic foods, that means they have everything in them. So we dose them according to teaspoonful. That's why I'm saying for the children, a teaspoonful 3 to 4 times daily.
Okay.
And for the adults, a tablespoonful 3 to 4 times daily.
That's for immune
That means,
boosting.
yes, to
Okay.
boost your immunity.
Okay.
And I will want to synergistically enrich that syrup by adding lemon. Okay, that means we are going to have a special combination of garlic, lemon, and ginger. These are often called the Trinity plants.
Okay.
The combination of lemon, ginger, and garlic is known as the Trinity plants. They are super duper foods, and these foods boost the immune system. So we are not talking about toxicity, okay? Because when you want to use certain plants, you need to look at how safe they are. These are food that we use every day. I'm sure in your cooking, you tend to estimate the amount of garlic you use because it's self-determined. Why? Because over the years and over long-term usage, you can be able to determine the quantity of garlic you do.
On a final note now, without seeming to maybe encourage people to indulge in self-medication, I need your final word on that. I equally need your final word to government and even the Nigerian people when it comes to looking inward, to start looking at what solution that can be used to address our problems in this regard.
You know, I'm very sad. I am sad in the sense that we have ideas, but we want the right people to listen to us. And what pains me is that people are easily to say, don't talk. There is no scientific evidences. Who are the scientists? Scientists are all over the world, including me who lives within Nigeria. Scientists are people who have wisdom. Some are intuitively designed to be able to come up with ideas and innovative ideas. So for us, especially in the field of pharmacy, in the field of research in the universities, can we bring out all those shelves and be able to bring out formulations, not even for now, even beyond COVID-19. This is a lesson to us. Everybody is on its own. India closed its borders to the export of paracetamol powder. We don't have. I wish to reiterate and state that in all our pharmaceutical products, all the raw materials, none is produced locally.
That's the active pharmaceutical
APIs,
ingredients.
active pharmaceutical ingredients. Okay. None is produced locally. That makes me sad as a scientist. I haven't gone through the university to read science. I'm supposed to come and do something for the benefit of our people.
Why is it not possible to produce them locally?
Because we don't have what it takes. We don't have the petrochemicals that can be able to carry out the processes, and we don't encourage research. We don't support research. You know, if you don't support research, how can you be able to get these raw materials?
To chemicals. Nigeria is an oil producing country.
But are you not exporting the crude oil? The most of the pharmaceutical raw materials are in the crude oil, are part of the fractions that are produced from crude oil. But you take your crude oil and take it out. So all the things that you need for pharmaceutical development and production of APIs, active pharmaceutical ingredients, is gone with the wind outside.
So COVID-19...
We pray that COVID-19 could be a blessing in disguise. A blessing in disguise that we should look inwards. I want to hear that something has come out of Nigeria as the giant of Africa. Not only Nigeria, in Africa.
Okay.
No drug has ever been produced in Africa. Maybe this is an opportunity. Wow. Because even the Western world is looking into Africa.
Well, we surely look forward to having that happen. Thank you so much, Pharmacist Zainab Sharif, for coming on Health Options.
It's always a pleasure to be here. Thank you.
Yeah. Having enough knowledge about the coronavirus and complying with the well-spelled-out safety protocols will no doubt go a long way in ensuring protection against it. Let's now join renowned medical virologist, the man who coordinated the 2014 Ebola virus disease outbreak in Nigeria, Professor Abu Salam in Asidi, for some enlightenment on viruses and, of course, more on the particular one that the whole of humanity is currently grappling with, the COVID-19.
If you were to start to describe what viruses are, they are among the tiniest living things that don't survive outside the cell. But they have all the information to replicate. So that means to reproduce themselves. They are part of the tiniest living things, because living things will reproduce. They reproduce, they infect, they move with cells and so on and so forth. They don't move themselves, but they move inside the body. Okay, so now, because of that, they are divided into different groups. But the most important group that we should know now is the type of gene they take. So there are a group of viruses that have the DNA genes, and then some, like the hepatitis virus, they have the main gene called the DNA. Then these other ones have the RNA gene, that is, another type of gene that, determines, information, reproducibility, and so many other things in the cells. So, the group of, RNA viruses, are the viruses that have this other gene, are the ones causing a lot of this infection now. The Ebola virus, belongs to it. The flu viruses, they belong to it. This coronavirus, that to which family belongs the SARS virus, the Middle East respiratory virus, syndrome virus, and then the current novel coronavirus. So they all have this RNA gene, which is encapsulated, which is, protected in a sac, like a capsule. Luckily for us, not all of those viruses are transmissible through vectors. Like the coronavirus, we thank God, is not transmissible through mosquitoes. At least they have not proven that yet, at least. So had it been it is transmissible through mosquito, then there's no need for social distancing. And so it's mostly transmitted through contact, either with the person that has it, or with the what he expels out of his body. Either when he sneezes out the droplets, or his secretions, and so on and so forth. The third one is in humans. That's why we are, bringing in the social distancing. So some of these viruses that survive longer outside the body, like the surfaces, our gowns, our pencils, our pen, our bags, whatever. Yeah, it happens because they can last maybe more than 1 or 2, 3 hours, or even days on those surfaces. So if you contact them and on your body, most likely they can't enter your body without being injected inside. So what happens is that when you have them on your hand where you pick them, and then you come back home, you don't wash your hand, you don't listen, and you go start to eat something or whatever, you put it inside your mouth or your eyes or your nose. So the cells that they can contact and enter into are plenty in the mouth, plenty in the nose, and in the eyes. That's why they said, the key to keep the virus away from us now, since we don't know, other means of its transmission, other than the contact and the ones I've listed, is as soon as you go somewhere and you touch things you're not sure of, and you come, wash your hands 20 seconds and make sure that you are home and this, and then you can use, if you don't have enough water and you have this sanitizer, you can actually, use hand sanitizer to at least, inactivate or get rid of the virus. You wash your hand, at least to keep the virus away from you. Why? The soap that you use in washing your hands, can melt the fat on the coat of the virus. So if the coat is melted, so the virus is useless. It cannot penetrate the cell anymore. So you have done that. If you use the hand sanitizer, it has spirit. Spirit also can, alcohol can inactivate the virus. So that's it. But if you don't wash or use these methods, and you go by chance, you just, scratch your eye like this, which many people do very frequently, or you scratch your nose or do something with your mouth, you just inject those viruses inside. And people will be looking, how did you acquire it, and so on and so forth. Maybe you even picked it from afar, or from somebody you shook hand with, he's having it, you don't know. And when it gets inside, it gets attached to those cells that are right inside our membranes of the eye, of the mouth, of the nose. They immediately get, those cells have receptors. So they just attach to them and start injecting those genes inside those cells. And immediately they inject those genes inside those cells, they now start dictating to the cells what to do. So the cells will now be multiplying their gene plenty. What they do is that, they take over the gene of the cell and change the information that instead of the gene to reproduce, they now say, reproduce me. So they call it coup virage. That is a coup d'etat. So the virus takes over the cells and dictates to it what to do. It's very dangerous, and because the more the virus multiplies in the body, what we call the viral load will increase, and then to start killing the cells, affecting human organs, and you start falling sick. Luckily, again, the viruses, especially this group of viruses with coats, are very sensitive to bleach, this ordinary bleach. So if you use 0.1% or 0.5% to always clean your house, clean your surfaces, your handles, you are free from those viruses. The stay-at-home strategy is the best social distancing strategy, to keep you away from the virus. Why? Because the chance of you acquiring the virus if you stay at home is less than 0.1%. as compared to about 80% if you are outside. You could meet a patient or a carrier or a patient without you knowing. Or, now in China, when they now did, the stay-at-home strategy, and they didn't combine it with decontamination of the surfaces and atmosphere, like in the city, they didn't get very effective results. That's why we are now combining stay-at-home strategy, so keep away from the virus for 2 weeks, and then at least 2 weeks, then they combine it with the contamination of surfaces everywhere. And after that 2 weeks, it means that the volume of people that are carrying the virus in the society must have reduced. So even if you come out, after that 2 weeks, the disease incidence goes down because number of people that carried the virus must have passed the incubation period. And if they are not sick, then they don't pose any danger to the society. The ones who present symptoms can be isolated and treated. So it is, if you stay at home, those who will fall sick will be minimal, and if they fall sick, they will call the medical team. Medical team can go test them and isolate them. Test them, and by that doing, you reduce the volume of the virus in the community.
For now, the best and most efficient way to avoid getting infected is through regular hygienic and sanitary practices, as well as social distancing. As individuals, we remain the greatest weapon to fight this pandemic. By washing our hands regularly with clean water and soap, disinfecting frequently used surfaces and areas, coughing into a tissue or elbow, and strictly adhering to infection prevention control measures in health facilities, we can contain this virus.
This is Health Options for this week. It is important that you follow the safety protocols on COVID-19, talking about hand wash hygiene, the use of hand sanitizers, social distancing, and staying at home. A quick reminder also that you can go to our YouTube channel to watch the upload of this and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi Abdullah. Stay safe. Bye for now.